your right to be skeptical, and you as the consumer need to escalate that it looks off to you, and us as the provider needs to think about ways to make sure that it's safe and secure.
Hello, and welcome to the Hi-Fi Health News Podcast. I'm Erika Grotto. Today, I'm sharing an interview from the Healthcare Financial Management Association's annual conference in Denver. I met up with Lisa Nelson, a pharmacist by training who was speaking at the conference about cybersecurity. But when we talked, she had a lot more to say. Take a look. Tell me a little bit about who you are and what brought you to HFMA's annual conference.
So my name is Lisa Nelson. I am a pharmacist by training. And the last 15 years, I've gotten into the healthcare technology space. And I was invited here to speak about cybersecurity, but also looking at a lot of opportunities where we can use artificial intelligence or AI in the revenue cycle space.
So cybersecurity, big topic. It's one we've talked about on Hi-Fi on and off. What should patients be most concerned about when it comes to cybersecurity in their healthcare? And is there any part of that they can take ownership and control of?
So first of all, the number two ways that cybersecurity impacts health systems and it impacts patients is actually still by phishing. So those emails that come that ask you to do something that your doctor wants to talk to you, or something that seems a little odd, your pharmacist wants to make a personal call or something like that, that those odd type of emails where they want you to click on something are still the number one way that a cyber or a bad actor gets into your system. And then we often get questions about well, if my personal home computer is infected, does that impact if I have MyChart or a patient portal, and can that come over? So the good news is that the MyChart patient portal stuff is kind of on its own server. It's kind of locked in a different room so that if you are actually get infected and have opened up your MyChart, you can't transmit it to the health system. The other part is that we also can't transmit it back to the patient. But if there is a cyber event at a health system, we will bring down all of our systems. And so the patient portal or MyChart could be unavailable if a health system is suffering an event. And the standard of practice now is to really actively communicate with patients when that happens, so that we can make sure that you are able to still have continuity of care while we may be dealing with any kind of cyber emergency.
So you bring up phishing, and it reminds me of something that happened to me a few months ago, and it was completely legitimate, but I got a text message, because it's a thing now. You get a text message, view and pay your bill, and it's so easy. You can just click it, you click pay, you're done. But how do you know when you get that text message that it's actually for a real, that it's real?
So because there is so many of those coming out, and again, we've all gotten them from random things. They'll say something like, I used to get them for years about an Amazon account that I never had an Amazon account.
Yeah,
So
I owe a lot to the Massachusetts Tollway Authority,
Yes,
and I don't even
tollway.
live in Massachusetts right now. Yeah.
Right. So right, exactly. So, and the way they get that is obviously as numbers, and it's on the dark web, and people are mining those type of things. So from my perspective, I don't pay my bills through a text app. It triggers me to go then sign into MyChart and actually pay it on the website. And if there ever is a time where you think you've clicked it and then you're like, oh, this just doesn't feel right, the first thing to do is, the old adage, if you see something, say something. You can call the help desk, you can call the call center, you can even call the help desk at the health system and just say, I think that something happened. They'd much rather hear it there and tell you, no, that's wrong, that was okay. And then actually feedback that we take is when I get those questions and it's not clear that we're sending out text messages that are appropriate or confusing, we change that verbiage. I am constantly on our vendors who we partner with, you can't just send random texts. I think of my 83-year-old mother. Sometimes people will say to me, this didn't come from a local phone number. It came from it looked like it came from overseas, or those kind of things. So, you have your right to be skeptical. But and as us as and you as the consumer need to escalate that it looks off to you, and us as the provider needs to think about ways to make sure that it's safe and secure, and we communicate that we're doing it that way.
So you mentioned AI as well. AI is all over everything right now. It's certainly been a huge topic of discussion everywhere at this conference. And I noticed just last week I went to see my primary care provider, and for the first time ever, she said, "Hey, do you mind if AI listens to this conversation, helps with the notes and all that?" What should patients be paying attention to there, and what should their concerns be, if any?
So um, ambient AI, one of the reasons, it's been around for a very long time. We've had large language models or machine learning. The reason that now it's able to listen to your conversation, send it to the cloud, and have it come back into the electronic health record in such a timely way is that the power of the cloud and the power of the chips and all that, are able to make it happen instantaneously. Um, Patients need to be thinking about, obviously, they're trusting us with their care. They need to, should ask questions like, where's this data going? Is it safe? The answer is yes. It's going into a secure instance, a secure cloud. It's not going out into the internet broadly. And it really stays there, and then comes back into the electronic health record. And then actually the provider reads the note before they accept it. So it's nothing happening automatically. And I think as we look at whether it be AI in the revenue cycle space, whether we look at AI for patient access, whether we look at AI as I ask my Google AI a question of what should I, eat over 4th of July weekend, um, it's being brought back, and then somebody has to make an active decision to use that. It's nothing automatic. We are not at the point where we're going to have AI taking care of you in the room, or it's not going to replace folks. It's taking tasks that we do in healthcare, many of them that are very administrative, many of them are repetitive, looking for vast amounts of information, writing denial letters for appeal when we have an issue with on the revenue cycle side, and it's allowing that professional, that healthcare professional, in whatever spectrum they're in, to assist them to be able to do those tasks better. And so something that would have taken 3 days now may take 2 hours, because it can pull all the information in the chart into a nice note written concisely and to the point, and then you can kind of check that and write that, versus having people go through the chart and actually dig through and find that information so that you can get that, expensive new rheumatoid arthritis drug.
Yeah, and I did notice when I was talking with my doctor, she was able to actually sit and have a conversation with me instead of asking a question and like typing away and then asking me another question and then typing away. And she said that she really likes it too. But it's nice to have to know that there's a person behind there who's kind of looking out, making sure that everything is right. Something else that a lot of patients might not be aware of, you hear about it a lot, but that there are shortages of all kinds of healthcare workers. There are physician shortages, which we all know because it takes us a long time to get an appointment with our primary care doctor. There are shortages in specialties. There are shortages of nurses. There are shortages of the billing folks. There's shortages. There's not enough of anybody.
Yep.
So this AI really provides a nice tool that the people who are there can work more efficiently.
Yep. And the nice part about it is, if you come in and they need to ask you, like your doctor did, do you want to be recorded? You can say no. You can say, you know what, I don't feel comfortable, and they won't record you. It's that listening. It's called ambient listening that then moves it to text. Additionally, if you bring in two little kids and they're running around, the tools are getting so good that they can be talking in the background about, going to the pool or playing with the dog, and it'll actually take that out of the note. So unlike recordings that we used to have where we had people scribing in the background, this actually is learning over time. It's learning the medical technology. It's also learning how things should be phrased together. And is also starting to be able to pull in things like the billing codes and the appropriate recommendations, and soon probably orders. So your doctor will be able to say you need to follow up in 6 months, you need to get a colonoscopy, and then those orders will be actually teed up in the electronic health record.
Wow. So, as a parent of young children who are yelling in the background of every conversation I have, that's good to know as well. That's it for us today. I'm Erika Grotto for Hi-Fi Health News. Thanks for watching.